Welcome to The Explainer. Today we're diving into one of the most common and most critical issues for newborns, that first vital struggle to take a breath.
So let's kick things off with a number that really puts this into perspective. A full quarter, 25% of all admissions to neonatal units for full-term babies are because of respiratory problems. That's a huge number, and it really shows you just how common this challenge is right from the very start.
So, what are we actually talking about here? Well, the medical term is neonatal respiratory distress, or NRD, but you can just think of it as a big umbrella term for any newborn who's having a tough time breathing. Now, this can be something pretty mild that sorts itself out quickly, or it can be a really serious, life-threatening situation. The key thing to know is that medical teams are incredibly well trained to handle the entire spectrum.
Okay, so how can you actually tell if a baby is in distress? It's definitely not just about crying. There's a very specific set of clinical signs that doctors and even really observant parents can look for that tell us a baby is working way too hard just to breathe.
And what's so fascinating is that each of these signs tells a story. Tachypnea is just a fancy word for breathing too fast. Nasal flaring, that's the baby trying to pull in as much air as possible. That little grunt you might hear during an exhale is actually the baby's instinctual way of keeping its tiny lung sacs from collapsing. And when you see the skin pulling in around the ribs, those are retractions. That tells you those little muscles are working in absolute overdrive.
Now, of all those signs we just looked at, tachypnea, breathing more than 60 times a minute, is considered the biggest red flag. It's often the very first clue that a newborn is facing some kind of respiratory challenge. So we know what to look for, but why does this even happen? And this is where it gets really interesting, because the reasons can be completely different, and it all boils down to one key factor. Was the baby born preterm or full term? And this slide lays it out perfectly. For preterm babies, the problem is structural. Their lungs just aren't fully baked yet. But for full-term babies, the lungs are mature and ready to go. The problem is usually caused by something else getting in the way of normal breathing.
For preemies, the #1 serious cause is something called respiratory distress syndrome, or RDS. This happens because they lack a crucial substance called surfactant. Think of it like a special coating inside the lungs' air sacs that keeps them from sticking together and collapsing. But their immaturity also leads to other risks, like BPD, which is a type of chronic lung disease. They can also have apnea, where their brain's breathing control center just pauses. And of course, their underdeveloped immune systems make them much more vulnerable to infection.
Now, flip the coin to a full-term infant, and it's a whole different story. The most common issue by far is called TTN, transient tachypnea of the newborn. This is basically just some leftover fluid in the lungs that hasn't cleared out fast enough after birth, and it usually gets better pretty quickly. But you can also have more serious issues, like infections, the baby inhaling meconium, or even an underlying problem with the heart. Okay, so when a baby shows any of these signs, the medical response is swift, and it's systematic. They don't guess. They follow a very clear playbook to figure out what's wrong and provide support right away.
And that plan is so reassuringly methodical. It starts with a rapid ABCDE assessment. That's airway, breathing, circulation, to deal with any immediate threats. Then come the diagnostic tools, like a chest X-ray, to pinpoint the cause. From there, it's all about giving the right level of respiratory support and starting any specific treatments that are needed.
Now, respiratory support isn't a one-size-fits-all thing. It often starts with something non-invasive, like CPAP, which uses a little mask or prongs in the nose to provide gentle air pressure to keep the airways propped open. But for babies who are in really severe distress and just can't breathe on their own, that's when you move to mechanical ventilation, a machine that literally does the breathing for them.
And here's where modern medicine is just incredible. Remember that common preterm problem, RDS, caused by a lack of surfactant? Well, there's a direct and often miraculous solution. Doctors can give the baby a man-made version of that surfactant, putting it directly into the lungs. It can make breathing dramatically easier, almost in an instant.
So let's say a baby's breathing is stabilized. That's a huge victory, right? But the journey isn't always over. Managing this initial distress also means being really vigilant about potential long-term complications that can pop up later.
You see, that initial fight for breath, especially for the most premature babies, can create these ripple effects down the line. The conditions linked to NRD can sometimes lead to chronic lung disease, issues with vision, or challenges with neurodevelopment. All of these require careful, ongoing care long after that baby has gone home from the hospital.
And all of this leaves us with a final, really hopeful thought. I mean, we've made these unbelievable advances from creating artificial surfactant to developing ventilation techniques that are so much gentler on tiny lungs. It just makes you wonder, as medicine keeps pushing forward, what's the next great breakthrough going to be? What's the next frontier in protecting a newborn's first, most critical breath?